Now with joints, um, there is range of motion, the amount of movement that can happen at the joint, as a synovial joint, uh, and things that limit that range of motion, which give the joint stability. Now, every joint has a function to perform, and there's a trade-off between the range of motion, the amount of movement that's allowed in the joint, and the amount of stability. Joints that need to be very stable tend to have way less range of motion, and joints that need a huge range of motion tend to not have very much stability. The shoulder joint, for instance, has the most mobility of any synovial joint in the body, so therefore it's the least stable. Lots of people dislocate their shoulders, whereas joints such as the hip joint needs more stability, therefore has proportionately less range of motion. So, what are the things that create stability in the joint? Well, there's basically three things. A list of three again. There are there's the shape of the bones involved, the shape of the articular surfaces. Now, in the case of the hip joint, it's a ball in a very deep socket that limits the range of motion but causes a lot of stability. Whereas in the shoulder, the glenoid fossa is a very shallow little cup for a very large head, so it doesn't give very much stability. So the way that the two joint surfaces interlock plays a role in stabilizing the synovial joint. We have ligaments that cross the joint, and they limit motion in a specific direction. For instance, at your knuckle, at the joint between the metacarpal and the proximal phalange of your index finger, you have the ability to flex it forward, right, and move it side to side. But you can't extend it, and that's because there's a ligament that runs down the palmar side of that joint that prevents extension of the joint. When you go to the joint between the proximal phalange and the middle phalange, which is called the proximal interphalangeal joint, you'll see that you can flex and extend it, but you can't extend it past straight, and that's because of this ligament that runs down the palmar side, the front of it. But you also can't bend it side to side. There's no ab or adducting that joint, and that's because there are ligaments on either side called collateral ligaments that prevent ab and adduction. So to a great extent, most synovial joints have got ligaments that limit range of motion in one of the directions, or maybe more than one direction. There tends to be a number of ligaments to do it. And anytime you force movement into that direction, you end up damaging the ligament. That's what a sprain is. Now, the third factor that limits the movement of a joint and causes stability of the joint are the muscles that cross the joint. And the nice thing about using muscles to stabilize a joint is that it's variable. By contracting the muscle, you can create more stability. By letting that muscle relax, you create less stability, more range of motion in that particular direction. So it's kind of more dynamic. You can choose the range of motion. These can be very, very important. Oftentimes, like if somebody tears their anterior cruciate ligament, the physiotherapist will have them work on the quadriceps muscles, because the stability they lose because of the torn ligament can be made up for with stronger muscle. And that's what a lot of rehabilitation is. Movement happens at the synovial joint because of the muscles that cross the joint. Uh, when we talk about muscles, we'll talk about origin and insertion. But basically, a muscle contraction causes the insertion to move towards the origin. And movements are talked about in the planes that they move, transverse, frontal, or sagittal planes, or combinations thereof. So movement that doesn't change angles is called non-axial movement. So these would be gliding movements, slipping movements, where two bones kind of glide past one another. Uniaxial are when the movement only happens in one plane, biaxial in two planes, multiaxial in all three planes, in sagittal, transverse, and frontal planes. So something like the hip joint is multiaxial because you can flex, you can extend, you can you can adduct, and you can rotate your hip. So it happens in all three planes. Where something like the proximal interphalangeal joint, you can only flex and extend. So that is a uniaxial. So when we talk about joints, we name them for the bones that are involved. And if those bones have got more than one joint, we'll list them as proximal and distal. So the joint between the radius and the ulna, there's a couple of them. One is the proximal radioulnar joint. The other one is the distal radioulnar joint. So we name them for the bones that are articulating with them. We can talk about their structural classification, we can talk about their functional classification, and we can talk about the movements that are allowed. So then this table kind of goes through all of the joints in the body and talks about what they are. So for instance, there's the lambdoid suture of the skull. It's a suture. It's synarthrotic, no motion. The temporomandibular joint is a diarthrotic hinge joint. It's a synovial joint, and it happens between the temporal bone and the mandible, etc., etc. So I'll let you look at these. I'm not going to be going into great detail on them. Okay, you'll notice that most of them are synovial. Kind of pay attention to the ones that are not, like the distal tib fib joint. It's a syndesmosis. That the pubic symphysis is a symphysis. Okay, so look over them. Take note of the ones that are special, that are different. So what movements can happen? So this is basically how we're going to describe movement. So there's gliding, there are angular movements, and there's rotation. So a gliding motion is basically a translation. It is it's a motion where the two bones slide past each other. Angular motions are when the two bones change the angle. So they can be flexion or extension, ab and adduction, something called circumduction. Rotation is they don't change angle, but they'll rotate around one another, so medially or laterally. Now, most movements can be classified as these three, but there are some movements that kind of don't fit in here, like so well. So we call these special movements. So supination and pronation are special motions. Dorsiflexion and plantar flexion of the foot. Inversion and eversion, protraction, retraction, elevation, depression, opposition. So we'll look at these in detail in a second. So the gliding motions, the surfaces have to be flat so that they can glide past one another. They don't change angles. So the intercarpal joints, the intertarsal joints, the joints between vertebrae, they're called the zygapophyseal joints or the facet joints. Now the flat surfaces are generally called facets, and so if you see the word facet, it's probably a gliding joint. Your kneecap has two facets, and it glides past the femur, the distal end of the femur, and so that would be considered a gliding movement. So the wrist tends to glide. Angular movements that move along that sagittal plane, front to back. If the angle decreases, it's called flexion. If the angle increases, it's called extension. If it's extended beyond the normal range, it's called hyperextension. So it's this. Flexion is the angle gets smaller. Extension is the angle gets bigger. Flexion, extension. Flexion of the shoulder, your arm moves forward. Flexion of the elbow, your forearm gets a smaller angle in relation to the arm. Flexion of the knee, your leg gets a smaller angle to the thigh. So flexion of the knee is bending your knee. Extension is straightening your knee. If it happens along the frontal plane, the movement is called abduction and adduction. Ab is movement away from the midline. Ad is moving towards the midline. We tend to say abduction and adduction because abduction and adduction, when said quickly, can be easily confused. So most people will say abduct or adduct because it's easier to make sense, to hear it. Now, there's a special movement called circumduction, which is flexion and extension, ab and adduction, all kind of concurrently. So if you flex your metacarpal phalangeal joint and then flex and abduct and then abduct and then extend and abduct and then extend and adduct and then adduct and flex and adduct and then go back to flexion, you will make your finger go through something called circumduction. You can do the same thing with your shoulder. So kind of the warm-up exercises that you do in your shoulder would be a circumduction. Circumduction looks like rotation, except the angle is always changing. Now, rotation happens when the bone moves along its long axis. So when you rotate your head or you rotate your leg, you're not changing angles, and that's considered rotation. If it's in a limb, rotating it medially or rotating it laterally makes sense. If it's in the axial skeleton, like your head, we call it left rotation and right rotation. So this one here is right rotation. This is left rotation. This is medial rotation. This is lateral rotation. Now, the special movements are things like supination and pronation. So it's a complex motion. There's some rotation, there's some changing of angles at the same time. So supination, I learned it as supine on your spine, lying supine, you're lying on your back. Other people will say supinate by, you have to supinate to carry a cup of soup. So basically, supination is palm up, pronation is palm down. So, and I will demonstrate this in class. Now, with your foot, the problem is that the ankle joint happens in the middle of the tarsal bones. So the calcaneus moving towards the tibia and decreasing the angle would be flexion, but moving your heel up towards, so your toes down, would be considered flexion, and raising the other side of the calcaneus, so bringing your toes up, would be considered flexion. So we call pointing your toes down plantar flexion, because you're moving to the plantar side. And we call bringing our toes up dorsiflexion. So a ballet dancer is in plantar flexion. Now, as you can see, this angle is changing. It's getting smaller here, and it's getting smaller here. It's the same two bones, and it's the same. So it's whichever angle. So we just call it dorsiflexion and plantar flexion. Now, because there's 7 bones in the tarsus and then the metatarsals, kind of turning your soles inward is called inversion, and turning them outward is called eversion. So this one is inversion. It's kind of bringing the sole of your foot, the plantar surface of your foot, to the midline. Most people, when they sprain their ankle, have an inversion sprain. They roll over on and they sprain this ligament here by over inverting the foot. An eversion sprain would be going the other way and hurting the ligament on the medial side. If you move in the transverse plane, we call that protraction or protrusion, and we call reversing that retraction or retrusion. So you protract your mandible, Bubbles from Trailer Park Boys, protracts. Right? Somebody with an overbite retracts the mandible. Protract or retract, protrude or retrude, either is acceptable. Protraction and protrusion are the same. I don't like to mix the metaphors, though. Like, it's funny, people will say they protrude their jaw and they retract their jaw. It's kind of like if you protrude, then you should retrude. But whatever, everybody knows what you mean, and it's perfectly acceptable. If you lift a body part, it's called elevation, and if you lower a body part, it's called depression. So shrugging your shoulders is elevation. Pushing your shoulders down is depression. Closing your mouth, elevation. Opening your mouth, depression of the mandible. In the thumb, the pinching grip, moving your thumb through a complex motion, is called opposition. And opposition, it really involves flexion, medial rotation, well, kind of extension, medial rotation, and then flexion, all kind of one after another. So this is called opposition. We can oppose our thumbs. We can also oppose our little finger. So bringing your thumb to your little finger is an example of opposition. And the muscles that do it are called the opponent's pollicis and the opponent's digiti minimi. Those are the special movements. Actually, those are all the movements.